Okay, so as George said, I am a PhD student at Lund University in Sweden, and I'm based at the Institute of Palliative Care and at the Department for Gender Studies. And I just want to thank George and the EAPC for the invitation to be here. And it's been so interesting learning about what's going on in Scotland and Lithuania. I'd be so interested in taking the EAS education at some point if I ever find myself in Scotland. So I'm going to be talking today about the implementation of last aid in Sweden, which we started just this year. And we're implementing it specifically in just one municipality to start with. And the education has been implemented with the help of a diverse network of local stakeholders, including myself at the Institute of Palliative Care, the local palliative care unit, the municipality, and different volunteer organizations as well as just various interested citizens that thought this was a good idea and they want to contribute in some way. I've been using a participatory action research methodology as part of a research project on the implementation of last aid, meaning that I've been co-leading this project in the capacity of both a researcher, but also as a community organizer. And our group of practitioners and volunteers in this program have created an action plan for implementing the education. And we've also organized quite a few workshops to reflect upon the strengths, weaknesses, and future directions of last aid in Sweden. And during this year-long research phase, I've taken a lot of field notes. I've held focus groups with participants and practitioners, and this really comprises the majority of my data for this study. And interestingly, I'm a social scientist and I'm based at the Department of Gender Studies. So I'm going to be using a feminist analytical lens to be analyzing the social sustainability element of last aid. And I'd really like to shed light on the social scientific dimensions of last aid as a public health program. And here I'm going to create more knowledge about the social sustainability of public health initiatives, particularly in Sweden and the Swedish context. So the question that I'm asking of my data is, how can last aid contribute to creating and maintaining a sustainable social ecology of care in the context of the Swedish welfare state? So what have we done so far? In the fall, we were actually able to hold 3 courses. 2 of them were on site, and then 1 of them was online. I've held 2 focus groups with course participants and 1 focus group with the practitioners. And throughout this last autumn, we've also had dozens of planning meetings and workshops that have been held between all of these different stakeholders. So with people in the municipality, people in the healthcare, people in civil society, all coming together. In total, we've educated approximately 75 people in last aid with very positive reception as indicated by the course evaluations. Furthermore, we've sedimented quite a lot of cross-border collaboration that didn't exist before. So we've been bringing together people from so many different sectors in the public, talking about palliative care together for the first time. We've also received significant media attention. 3 articles have been published in local newspapers. 2 articles have been published in healthcare-focused magazines. And you can see here the title of this article in Swedish says, last aid is just as important as first aid. So as I previously said, my research on last aid is framed around how care at the end of life can be analyzed on the level of social sustainability. That is, what preconditions are necessary for acts of informal caregiving at the end of life to be possible, and what consequences come from empowering caring in the informal sphere of life. And this is a general question for the compassionate community movement as well. So many feminist scholars have concentrated quite a lot on understanding the labor put into the birthing of children, caring for the elderly and dying, and also the maintenance of social ties, the home, supportive networks, and the basic provisioning of food and other vital resources. And they've stressed that this work is the basis of any functioning society, but it's often overlooked and undervalued. Last aid is a public health strategy which aims to strengthen the capacity for caring in the informal sphere of life. Compassionate communities comprising initiatives like last aid also aim to increase awareness of the value of care work at the end of life and the struggles that are part and parcel to serious illness and grieving. But what does it mean to empower care in the informal sphere? And what consequences does that have for how our societies perform and think about care around the dying and the grieving? So I can, in this study, only speak really to the Swedish context, and there are several different sites and discourses of care in Sweden. But one important one to discuss is the welfare state. So the Swedish model of welfare has a very rich history. While the model was developed more than half a century ago, it still has a very strong legacy in the way that the modern welfare state works and Sweden's overall ideology around care. So the Swedish model was based off of two primary ideals: universalism, which means that care should be equally available to all based on need, and defamilialization. And that's a complex word that basically just means that people should be able to live independently and not have to rely upon family structures. So in Sweden, there's a very high value placed on the social, emotional, and economic independence of older persons, which perhaps shed a different light on what compassionate communities can mean in the Nordic context, where independence is maybe more important than having strong dependence on civic society. And has this changed during Corona with the rise of many mutual aid movements? You can see here a poster for helping risk groups organized on Facebook. And this is not something that my study can fully answer, but it definitely should be investigated more. There's also an important gender dimension to empowering more care activities in civil society. You can see here that over 70% of people who get government assistance for caring for a sick loved one are women. In the year 2000, almost twice as many middle-aged women than men provided care for a dependent family member in another household. And women also provided considerably more frequent help than men. And beyond being gendered, this dynamic is also very classed, with the majority of this burden being taken on by working class daughters. And as I think George mentioned before in the last aid presentation, a huge majority of people who take last aid are in fact women. So in total, Sweden is definitely actually moving towards more refamilialized care, meaning that progressive strategies for building capacity for care in civil society are becoming ever more important. And you can see that here in this graph, which shows the combinations of different sources of help available to non-institutionalized older persons, so people living at home with serious illness. And you can see here that the proportion of people that were receiving help from government institutions decreased significantly between 2002 and 2010. And then the majority is people receiving help from outside sources, family and friends, or privately acquired services. So the questions and tensions that I seek to explore in my study about last aid are how building capacity for care through last aid can contribute to creating sustainable modes of care, where gender and class dimensions of care are not made more unequal. Moreover, how do public strategies like last aid fit into the Swedish welfare state's model of care? And what does that mean for defining compassionate communities in the Nordic context? And that was all I had to say. Thank you so much for having me, and I'm happy to take any questions.